Hello, Miss Duke. My name is Kayla. I'm going to be your UNCW student nurse for today, and I'm just here to talk to you a little bit about discharge. Before we begin, I'm just going to check your name and date of birth, and I see it's right. And we're here to talk about discharge. So yay, you're finally getting to go home and getting back into your normal routine, so we're so excited about that. But before we go, we just want to give you a couple of advice and a couple of resources you can have to take home. Is that all right with you? So, throughout your stay here at the hospital, you've had a couple of incidences, so we just want to give you tools and resources you can use when you go back home, so that way it won't be a problem. So the first thing we want to talk about is your management of your type 1 diabetes. So as you know, if you have type 1 diabetes, your body cannot make insulin. So that means you're going to have insulin injections and insulin shots to keep your body healthy. As you mentioned earlier in your stay at the hospital, you were nervous. You didn't feel like you had enough money for insulin as you lost your job. So before you leave, we want to connect you with a diabetes coach and a diabetes management team. And they have resources you can use to help you get insulin at a lower cost, and also resources to use so that way you can live a normal life and not have to worry about this issue. So next, we just want to also talk about some social problems that you mentioned while you were here. So you mentioned that you were interested in quitting smoking as you had moved down from 2 packs to 1.5 packs a day or something similar to that. So what I suggest is using resources. So one resource I want to give you today is smokefree.gov. So smokefree.gov has the opportunity for you to make your own smoking quit plan that is specific to you. Because the thing with smoking is that we all have different needs, and you said that you were stressed and that's why you smoke. So this website can give you some good resources. In addition, I encourage you to find an activity to do when you're stressed instead of smoking. For me, I like to go to the beach. For others, they like to go work out. So find something that works for you. It could just simply be turning on a good episode of TV to watch to cool down, or maybe having something fun to drink or eat, or a good snack, something like that. So I encourage you to look more into that. In addition, I'm going to give you the names and addresses of a few food banks that you can use, so that way you never have to worry about being hungry and trying to decide if insulin or food's more important. So that way you can have both. Also, we've talked to the social worker, and she's going to come around in a little bit and tell you more about jobs. So that way you don't have to worry about not having a job, and you can get connected with another place. There's lots of organizations that will hire people fresh out of the hospital once they're healed up, and we want to connect you with them. In addition, I know you stated too recently that you did not want to move. You wanted to stay in bed, and you didn't want to get up and exercise, and you also didn't want to use some of the devices that we had ordered. So I really want to encourage you when you go home to move. Don't just sit in bed all day. Don't just sit on the couch. I encourage you to get up and walk around, go outside, walk around your yard, maybe find a couple of girlfriends in the neighborhood who you can go on walks with, so that way you can promote healing. Because if our body stays still, we're not going to heal. So we need to move, and it's going to be really important for your health. And that way, if you move, you will feel more like yourself. Next, I just want to talk about your surgery. So while you were here, I know you had an appendectomy. So do you know what an appendectomy is? That's right. So an appendectomy is when your appendix was removed because you came in and you had an enlarged and inflamed appendix, so we had to remove that. And so when you go home, I just want to give you a couple of options you can do to help care for yourself. So first, please make sure you're taking your medications as required. Medications are important for healing, and I just want to encourage you to take those medications daily. Don't do any extremely strenuous lifting, and don't drive until your doctor says it's okay. Okay, and also give yourself a couple days to go back to normal activities. I know you've been here a couple of days, so you're getting close back there, but just make sure that if you're hurting, you take time and you stop. You know your body better than anyone else does, so make sure you're caring for your body. As for your incision site, It looks very healed up now before you're leaving, but it's just really important that you're going to wear loose fitting clothes. Don't wear super tight tank tops or tight shorts. Make sure you're comfortable so that way it's not rubbing on that site. Shower as normal, making sure to wash around that incision site gently with soap and water. That's super important. I don't encourage you to take a bath. I encourage a shower, and I don't encourage you to go swimming in a pool or in the ocean, as that can irritate the healing. And if your incision site has little white pieces of tape across it, leave them there for 10 days, okay? In addition, after having this surgery, your diet changes a little bit. So make sure to drink 6 to 8 glasses of water a day, which is important to do anyways, but super important when we're promoting healing after surgery. You also should take a fiber-based laxative if you're constipated. You may also use a stool softener. And we want your diet to be bland and a low-fat diet. So a couple options you could have would be like mashed potatoes, spaghetti, rice, pudding, low-fat yogurt, low-fat milk, and very ripe bananas. So, in addition, do not drive, like I said, if you are no longer taking prescriptions like pain medications, okay? So you don't need to drive if you're taking very heavy pain medications, as it can be dangerous. Limit your sports until you're completely healed up. And just to make sure that you are not lifting anything super heavy. So don't lift anything heavier than 10 pounds, super important. And so now you may be asking, okay, I don't know everything, so when should I call the doctor? So we want you to call the doctor first and foremost if you feel very uncomfortable. So if you're feeling like you're having a symptom or a sign that is out of the blue, it's making you anxious, raising your anxiety, please call the doctor. We are here to help. The team is here for you to do better. Please give us a call. But specific signs when you should call the doctor: if you have swelling, oozing, more pain, or abdomen redness around your incision. So if your stomach is just cramping super bad, if you have very bad pain, please call the doctor. In addition, if you have a fever greater than 100.4, please call. If you have chills, increased belly pain, severe diarrhea, bloating, or constipation, please call. And if you have upset stomach or vomiting, also call. Also, please give us a call if you're having shortness of breath or leg swelling, as leg swelling could be deep vein thrombosis, okay? So also, we are giving you a medication to go home with. So we want to just educate you on warfarin. Have you ever taken warfarin before? No? Okay. So warfarin is an important medication for blood clots. It's used to prevent blood clots, and it also reduces your risk for a stroke or heart attack. Okay? So before you start this medication, please let us know if you've ever had a stomach ulcer, vomiting of blood or red or black stools, a blood disorder, a stroke, kidney or liver disease, or lupus or other collagen vascular diseases. Also, when you're taking this disease, please, or before you're taking this, please let us know if you think you're pregnant or if you're breastfeeding, if you're younger than 18, which we know you're not based on your chart, if you had a recent dental procedure coming up or surgery, and if you've had a spinal puncture. Many medications cause problems if you're taking warfarin, so please contact your healthcare provider, just because we don't want it to be dangerous. Also, if you're taking any other medications you haven't let us aware of, please let us know, so that way we're making sure nothing contraindicates with each other. Which just basically means that that one medication is not gonna make the other medication worse, and that they mix together. Because sometimes when we're taking medications, they can kind of bounce away, but we want these to mix, if that makes sense. Mix in a good way. So, we want you also, if you're prescribed warfarin, please take it as directed. Okay, take it at the same time every day. Take it with a full glass of water. You can take it with or without food, so you can take it before your breakfast or after your breakfast, whatever your doctor has prescribed. It can be really helpful to get a pill box. I know for me, when I'm taking my medications, I can get confused if I've taken it or not. So preparing a pill box is very helpful. If you miss a dose, please call your doctor right away. We want you to be healthy and safe, so please call your doctor and never take a double dose, okay? So that's what to remember. If you forget to take your dose, call your doctor and don't double dose, okay? It's also important to keep foods Keep steady foods in your diet when you're taking this medication. Many foods contain vitamin K. Vitamin K is a substance that helps your blood clot. So, if you eat a lot of vitamin K, this can affect the way that warfarin works. So here's just a couple of foods that contain vitamin K. Asparagus, avocados, broccoli, cabbage, kale, spinach, other leafy greens, and oils. So just to be careful. Also, when you're taking warfarin, it's important to keep the amount of food steady in your diet. So it can be important to keep cranberries and cranberry juice, fish oil supplements, garlic, ginger, herbs, and alcohol, okay? If you change your diets or if you start drinking one more or the other, please let your doctor know. You can call them or you can notify them via my chart, okay? Next, we want you to prevent injury. So warfarin is taken for bleeding, okay? So it's all about clots. So you need to be really careful. Warfarin can make you bleed more, so if you get hurt, you could have more damage. So in order to help this and prevent injury, don't walk outside barefoot and don't walk inside barefoot. We can still hurt ourselves inside. Wear shoes. So don't be careful with your foot care. Don't just do routine foot care, just like trim your toenails. Don't try to do anything excessive that you haven't done before, as it could cause a lot of bleeding. I recommend using an electric razor rather than just a regular one, as it can be easier to cut yourself with a regular one. And use a soft bristle toothbrush and wax dental floss, okay? Also, avoid activities right now that could cause injury. So maybe you shouldn't be playing football when you're taking warfarin, as that could be dangerous. But if you have a serious fall, a blow to the head, or any other kind of injury, please let your doctor know. Please go to the doctor immediately as well. So if you're taking warfarin, it's important that you're going to your doctor when you have appointments, as you need to have blood work done, just so that we're making sure that everything is normal. These blood tests, they check your international normalized ratio and prothrombin time, which is big words, but just basically means how your blood's clotting. So we want to check that out, as that's what warfarin's used for. So just make sure you're going to the doctor's appointment. If you don't have a car right now, if you're not driving, try to schedule someone to pick you up. We can set you up with an organization that can come pick you up to your doctor's office, as there's many resources, okay? So, and a few important tips. Make sure you report any new medication started when you're on this medication. Don't stop taking this medication without telling your provider, as it can be very dangerous. Tell all of your doctors that you're taking warfarin, even your dentist. Please let your dentist know, as it can be important. All of your medical personnel. You can wear a bracelet that can indicate that you're taking warfarin. That can be important. Keep all your appointments for your blood test. Talk with your healthcare provider who prescribed you this warfarin before taking a new medication. And tell them if you have any changes with your contact team. Lastly, when should we call 911, okay? If your bleeding doesn't stop for 10 minutes, if you cough up blood, if you're vomiting blood, if you're having diarrhea, if you're dark red or brown urine, red or black tarry stools, dizziness, fatigue, headaches, any of those symptoms, chest pain or shortness of breath, serious fall, symptoms or signs of a stroke, an allergic reaction, if you have severe pain, loss of sensation, your color in your skin changes, maybe you're getting really pale or really blue, please call your doctor, okay? And lastly, when should you call your doctor? That's when we should call 911. This is when you call your doctor. Call your doctor if you're having swelling or pain after an injury, swelling or pain at injection site, if you have bleeding gums after brushing your teeth, bleeding hemorrhoids, heavier period or menstrual cycle, and red or black bruises. So that's all I have for you today. If you have any more questions, please let me know. And it's been an honor to work with you. Thank you.